In coronavirus news, cases are rising in some parts of the country. In parts of the north and the west, they are feeling the strain. Recent data shows infections going up in almost 30 states. The FDA is considering whether to authorize Pfizer booster shots for all adults. But leaders in Colorado, New Mexico, and California are issuing their own guidance, encouraging adults to get an extra dose. Currently, the federal government considers high-risk people and those who got Johnson & Johnson for their first shot to be eligible for boosters. Joining us now is Dr. Mark Kline. He is the physician-in-chief at Children's Hospital in New Orleans. Dr. Kline, it's great to see you again. Happy Monday. So let's talk about what could be fueling this uptick in COVID-19 infections.
Well, this virus just won't go away, will it, Vlad? It's, it made the rounds of the South during the summer. We had a terrible surge across the South, and now it's hitting the Midwest, particularly Michigan, Illinois, Minnesota, parts of the West. You mentioned New Mexico and Colorado are being very hard hit. There are even some areas in the Northeast where there's been an upsurge in cases. I think that as it hits a particular region and mitigation measures are put in place, the numbers come down, and then it moves on to another part of the country where people have gotten a little more casual and are not observing all of the mitigation measures, and it just cycles. And unfortunately, because only about 70% of adults are vaccinated, fully vaccinated in the United States, and smaller percentages of adolescents and children, we remain vulnerable. We've not reached herd immunity, and we still are vulnerable to this virus and will continue to be for the foreseeable future.
Doctor, you're based in New Orleans. We know that New Orleans was hit hard pretty early in the wake of Mardi Gras festivities back then, before we really knew how contagious this virus was. I'm curious about how things are going now. How does it compare to last winter?
We're doing phenomenally better, Anne-Marie. That is a piece of good news, particularly for us. We had the highest case rates in the nation in August and early September, and now we are amongst the lowest. The same is true of Florida and several other states in the South. So we think that the mitigation measures that were put in place, and in Louisiana, that included mandatory masking in the public schools of all children 5 years of age and older, teachers, school staff, mandatory masking in restaurants and other public places. If you had to show your vaccine card to get into restaurants and public venues here in New Orleans. So we think all of those measures had an effect. And at this moment, we have very, very low case rates, low rates of hospitalization. We're very pleased about that. But we're not smug about it. This could reverse and trend the other direction. And I'm worried about the winter. I'm worried about the flu season upcoming. I'm worried about what COVID still has in store for us over the months ahead.
Dr. Kline, help me understand something. I took a look at the New York Times coronavirus tracking data, and on their website, and everybody can go and see it, they show where the hotspots are, and they show where vaccination density has occurred. And if you look at the global map, in other words, the entire world, you see that the United States is bright red. And when I look across the pond to Europe, but specifically Africa is where I want to focus on, I see that Africa, there is not one country that is considered a global hotspot the way that the United States is. And yet, when I look at the vaccination data, it shows that the United States is mostly vaccinated and Africa is not. So help me understand what's going on there. Where more and more Americans are getting vaccinated, more and more Americans are getting booster shots, and yet the U.S. is still considered a global hotspot, whereas in Africa and other countries across Europe and the Middle East, they don't have the same vaccination rate that we do, and yet they're not considered hotspots. What's going on?
Yeah, it's a tough thing to fathom. Having worked in Africa myself for 15 years as an infectious disease specialist, I can tell you that I'm certain there is gross underreporting of cases in Africa. A febrile illness, an illness with fever in Africa, is often diagnosed clinically as either malaria or tuberculosis or something else. When a new disease like this comes along, it's rarely recognized. The laboratory infrastructure for confirming it is not available in very many places. So there's no doubt in my mind that there is gross underreporting in Africa. But the question that you're asking about the United States is very relevant. You know, if we're at 70% vaccination rate for adults, why are we still seeing so many cases? And I think the answer is that there are still a number of people who are not vaccinated, and we have high baseline rates of community transmission. And no matter how good a vaccine is, if baseline rates of community transmission are high, some of those vaccinated individuals will have breakthrough infections, and you'll continue to see lots of infections, of course, among the unvaccinated. Let there be no doubt the unvaccinated are driving this pandemic. Rates of infection are 6 times higher here in the United States among the unvaccinated. Rates of death are 12 times higher among the unvaccinated compared to the vaccinated. So while we hear about these breakthrough infections among people who've had vaccine, they're a consequence of the fact that we still have a lot of unvaccinated people who unfortunately are falling ill and transmitting the virus.
I want to ask you a quick question before we have to let you go about kids and the virus. We know that, you know, kids now 5 and older are eligible for the vaccine. It seems like, you know, parents are willing to get their kids vaccinated. There have been many, many appointments already booked, many kids already getting their first shot. There's something that we don't often talk about, though, when it comes to kids and the vaccine, and the virus. And it's about the impact that it has on kids. We always say, oh, they don't get as sick as adults do. But one study finds that over half of the kids ages 6 to 16 have at least one COVID symptom more than 120 days after their infection. Doctor, can we talk about what kind of lingering effects that we are seeing when it comes to long-haul pediatric patients?
Yeah, Anne-Marie, I think that this is such an important question and issue. And we are just now learning about long-haul symptoms in children. We know that adults complain of a variety of symptoms: malaise, brain fog, many, many others. And we see the same sort of manifestations in children. The difference is that children are growing organisms. So we don't know, for example, what the brain fog that's described in adults, what effect will that have on a growing brain and a child's ability to learn? We really haven't explored that at all. We'll find that out over time as children are followed for longer periods. But that's a significant concern. What will be the impact on other organ systems? What is the impact of COVID and these long-haul symptoms on a child's mental health? Again, all of this is just a black box at this moment, but I think it's a strong argument for vaccinating children, because we know the vaccines are safe and effective, vaccinating children and preventing them from getting this infection in the first place and being put at risk for what could be long-term or even lifelong consequences.
All right, Dr. Kline, always great to have you. Thank you very, very much. This has been really, really helpful. We appreciate it.
It's good to be here. Thank you.